Moss Minutes. Well, what I'm going to be talking about today is actually a follow-up to a Moss Minutes I did on May 26, and I talked about a very interesting study entitled Antioxidants Prevent Health-Promoting Effects of Physical Exercise in Humans by Ristow et al. And the point of this study was that in healthy populations, and I emphasize in healthy populations, I mean young men who are exercising, when they took antioxidants, namely vitamin C and E, there seemed to be a negative impact on insulin metabolism and, by extension, a negative impact on exercise performance. And my point, of course, was that, yes, there are certain situations where antioxidants may not be appropriate. And as you might expect, there was some concern about this generalization, and it is a generalization. And most recently, in the current edition of Alternative Medicine Review, this is June 2009, there was an editorial by Dr. Catherine Head, and taking Ristow et al. To task, saying they just overgeneralized, giving the idea that antioxidants are inappropriate for physical exercise. But what's the problem with the editorial? In my opinion, was that Dr. Head was also kind of generalizing, giving a picture that you can never go wrong giving antioxidants. And, you know, there's an old saying that no generalization is worth a damn, including this one, and I think I would have to say that any time we start generalizing about anything, including antioxidants, well, we're going to get in trouble. And the fact remains is that there is a place for antioxidants, and there are times when they're inappropriate. Now, when is it appropriate to give antioxidants? Well, when you think about it, and this is what the literature states, is, well, when people are deficient, when they're depleted. And when are they going to be depleted? More often than not, when they're sick. So I emphasize in this study by Ristow et al., this was done in healthy people. Do they need antioxidants? Maybe not. In those cases, it may be detrimental. But there's plenty of research that is showing in sick people where they are helpful. For example, here's a paper on stroke patients, very helpful. Another patient in looking at cardiovascular disease, very helpful. But again, we have to discern who is going to be best, more qualified, most needy, have the most need for antioxidants. And with that in mind, I want to read you a quote here from a very interesting paper from the British Journal of Nutrition. Studies also suggest that vitamins would be beneficial to individuals who are antioxidant deficient, that makes sense, or exposed to increased levels of oxidative stress, for example, smokers, diabetics, and elderly patients, emphasizing the importance of a subgroup targeting. Through defining the right population group and the optimal vitamin combination, we could potentially find a future role for vitamins in cardiovascular disease. Common sense. Find out who's most deficient. Find out who needs the most. Those are the people who probably get the most benefit. Now, before leaving, I want to make one other important point. As we know, chronic illness is very often a combination of factors. And I want to tell you about a very interesting quote by Dr. Kamel, and talks about that really when it comes to oxidant stress and antioxidant need, there's two sides of the coin. And he makes a point that the other side of this coin is inflammation. And as most of you know, inflammation is like the common currency of chronic illness, from hemorrhoids to hangnails. The research is very clear. And so what we're finding out, we can no longer just do one thing and cure illness. We have to do several things from a functional medicine, nutritional standpoint. He makes the point that if we're going to give antioxidants and get benefit, we also have to address the critical issue of inflammation. So I want to leave you with that thought. If you're thinking of giving antioxidants to people who really need it, if you want to get maximum benefit, take a look at the issue of inflammation. As you know, there's many ways that we have now of addressing inflammation, from enzymes to herbs such as curcumin, turmeric, many ways that we can help reduce inflammation. With that kind of multi-phased approach in mind, we can use antioxidants and get the best results. This is Dr. Jeffrey Moss. I want to thank you for joining me for this edition of Moss Minutes. I'm looking forward to talking to you next time.